has a tube, if he's on a ventilation, then you need a colleague.
No.
You need a colleague to hold the tube or to mind the tubing. So, but then you also want to figure out, how am I going to move? Like, where's the head going to go? And so you need then to put the scale like this. And so the colleague needs to stand here, and then you have to anticipate, where do I stand and where the tubing go. So then you say, okay, we'll lift you up, and you can gently just, you know, go slowly. And the patient will move, but if you go slowly, and when it moves too much, you just wait a bit, and then you go really slow. On a scale. Right. And then you wait, and he starts moving again, you wait, you say, you're fine, you're just on the scale. I'm going to put you on your side. So either when you go on the side, then you need something here, or you keep the baby, you know, yeah, usually you just put them on your side, or they need more support than just this. The thing is that they don't know where they're going, so they might be frantic, you know, they're just not, and the slower you go, the less frantic they get, because they, you know, they don't realize that they're going anywhere, it goes very slowly. So the other method is that with mothers you can do this, and you can do it yourself, is to, now I'm going to put you back, you can weigh your body in, and this is sometimes difficult when you're not as tall as I am, but you weigh your body in, and then you hold the baby against your body, and you wait. This is a strain on your back, actually. So you wait until the baby is breathing, and then you slowly stand up. It's all a matter of feeling if the baby breathes or not. So then, you know, your colleague is doing the tubing system. So then you stand there, and then your colleague can put this out of the way, so she can have more room. So she's standing here, she's holding the tubing, and then you gently rotate, and then you go back, and then you place, you place the baby back in the incubator. So you go slowly. This is even too fast, but I'm not feeling the baby, so because the baby doesn't move. But if you move, then you feel the baby, and if the baby tenses up, you say, it's all right, you know, it's all right, you're just going to go back into the incubator. Just one or two more goes, and yes, I know you feel that I'm moving. That's fine, just keep on breathing. Now we're going to put you back. And so then you slowly and gently place the baby back. Hey. And if the baby is sort of moving a lot, then it means that you just have to go more slowly. Or you know, or you can swaddle the baby a little bit more, and then you're back in the incubator. And then usually you put the baby in the position that you would like them to.
Yeah.
So that if you want him on your side, that you can put him like this, or when you put this side, you put him like that, so that you don't have to move him again. And then you wait. You just wait until the baby settles. With this baby, you saw that the baby became really pale, and then you just need to wait. And you sort of need to wait for the breathing to start again. Because that's really what they're telling you. You're like, I'm holding my breath in anticipation of what the danger is coming. So they can't breathe. And so then if the baby's on his side, and maybe sometimes when it's been very hectic for the baby, you can also just leave him in the swaddle, and then make sure that he has something against here, that you put something here, that when he doesn't roll, that you can, you know, that you can put it, and that's where you would like a more flexible nest, so that you can put him like that, and that he doesn't move back like this, and so that he can be not tight but supportive, so that he can be supported. So this is really too small for a baby this big, but a baby this big, I don't think needs a lot of nesting, because that also probably means that the baby is developed further and needs less support. So it's all a matter of expectations. If you're like the baby we did yesterday, you know that she can be very wild, And then you say, okay, what do I need? And if the baby doesn't have a blanket like this, yeah, that's going to be difficult. So hold on a second. So then you have a choice. You can either, and that's what I was looking for yesterday, you can use this, you know, sort of, if she has that to lie on, and you can take this and you wrap the baby up, and then you have a choice to go with the baby and go slow and just hold the baby against you, hold her, and then slowly lift her, and then you wait. You wait, in every new position you wait and you talk to her, and then you turn. But you go as slowly as I'm going now. So the whole thing that in the old days, we would say, hello, put you on the scale, we take you, and we're just like that, then you know you're in trouble for the rest of the day. Because, you know, then going slowly and getting everything done in one go, that's not right. So there are the options, and you have to experiment, you know. And that's the whole thing. You can try and you can make a mistake, and then you learn from this. That's the whole thing. And when you forget, you know, when you have a new nest, you say, okay, do I need to use this to lift and things? And you say yes. Well, then you prepare this. And sometimes, you know, somebody talks to you, you forget, and you go, oh, I forgot the nest. So that's the bowing in and holding and then coming up, you know, and then waiting before you rotate. So you're only making one movement in one plane at the same time. And then you breathe yourself, and together you breathe, and then you start, you know, you sort of move. But the beauty is that when you have the baby against you, you feel the baby tense up. And then of course you don't want all these flaps here when you're lifting a baby. So you have to be mindful, you know, you have this NIDCAP badge with the needle, and so you put the baby against it and the needle sticks in his eye. So you want to think about those things. And yes, you will forget. You're like, oh shit, I still have this. You know, sort of, then you have to take it out. But those are the things that you want to be mindful of. And you go back and you go slowly. And it's easier with a real baby because they will let you know how far they are and if they're moving or if they feel safe or not. So